Hi, my name is Angela. In this video, I'm going to be talking about how I organize my inpatient workflow as a pharmacy resident. Currently, I'm a PGY1 resident, and this is my first acute or inpatient rotation. I am an ambulatory care track resident, so inpatient is not the most comfortable area for me. So I thought I would just cover my experience and then how I kind of organize this workflow in a way that I think would be helpful for someone who's just not used to it, because it is different than when you go on rotation as a pharmacy student versus a pharmacist and residency training. Of course, this would not apply to a pharmacist who's been working in the acute care setting for years and years. This is just for someone who just wants an experience of someone who's new to it and maybe how they organize their workflow. But the rotation I'm in, so yes, it's in the hospital, it's in the acute care unit. Sometimes we have patients in the ICU or the immediate care, like step down areas, but majority are in the non-ICU setting. And so it is a nephrology rotation, so a lot of kidney stuff, a lot of dialysis stuff, but that's a lot of the kind of patients that I'm seeing this month. But usually the workflow starts with working up patients in the morning, so I do get up earlier than in my ambulatory care rotations, and I work up patients and kind of wait until labs come back, wait until notes are dropped and things like that, and then review and update certain things. But then we go on morning rounds with the team, and that usually takes probably 2 or 3 hours at least. Then break for lunch, check back on some other levels and things like that, and then we kind of follow up on things in the afternoon. And sometimes I'll have meetings or I'll have discussions with preceptor or topic discussions. I have a student with me on rotation as well, so the afternoons can look very different, but at the end of the day, I'm making sure that all of the things are updated that need to be from a pharmacy standpoint, and making sure all the medication adjustments are entered, notes are entered for evening pharmacists and evening team who will be taking care of those patients. So aside from that, there's just other things like discharging patients. As a pharmacist, we review the discharge medrec orders to make sure that they're correct, and then also patients getting admitted who have admission medrec, we review those and make sure everything's appropriate. That's ordered inpatient. We verify orders, order labs, change meds, answer questions from the team, nursing, whoever needs their questions answered about medications. And then one thing I didn't know is some EHR or electronic health record systems have little areas for pharmacists or pharmacy team members to update what's going on from a medication standpoint. So as a resident, I've been responsible for updating that, and so that's just kind of like a little notes section that's not just for me, but it's for the whole team taking care of that patient in the hospital on the pharmacy kind of track. So the main difference between being a student and being a resident is that I can now enter orders, change orders, and verify orders. So as I'm going on rounds with the team, I now am verifying orders that they put in for the different patients. So even after we've gone through a patient, then the orders will come through later. And so I'm getting to see that part of the workflow. And if the team asks me to put something in, I can now directly put it in, and I'm responsible for making sure it's correct and all that kind of stuff. So it's really added, I think, to the experience in terms of letting me see exactly what the orders are, when they get put in, what the time is. So otherwise, as a student, you're kind of having to look retrospectively after it's all happened, and you may forget or lose some things, but when you see it come through your queue and you see exactly what the order was, you remember better because your name's on it and all that kind of stuff. So I also have other responsibilities, like there's pager systems now that I can be called upon to answer code blue and other rapid response kind of things that I have now tied to my device or whatever to alert me to that, so I didn't have that as a student. And then just even the view of what you see as a pharmacist versus a student, you can see so much more in the chart. As a pharmacy student, for like safety reasons or whatever, privacy reasons, they don't let students view everything, but now you can see everything. So definitely way more helpful, no more barriers to access, and you can just see the same thing that your preceptor's seeing. So it just makes learning a lot easier. I've gotten to round alone at some times with this rotation. I've gotten that experience, and so I think that's been really good, because otherwise as a student, I don't think I would have. I didn't have the knowledge or the ability, again, to verify orders or do all those different things. So that's been really cool. And then I can message my preceptor when I need help, which still gives me the support I need, and then also the autonomy with rounding alone. So, the things that remain the same are there's still topic discussions, there's still writing just general pharmacy to dose notes in the patient's chart, making recommendations to the team, working up patients, that's all pretty much the same. So, it is a real blend, but it definitely has an added workload to it. So I personally get a little bit confused with all the different patients, and it just is hard to remember each and every one when you work with so many or work with so many different people. And so the EHR that I work with has, like I said, that notes section that is kind of for everyone, but I can't make it personalized to me, aka I can't just write whatever I want on there. So one thing I thought was helpful, most computer software systems have this like a sticky note type of application. So I have a PC, not a Mac, so it just, it's called sticky notes. So I have to pull that up and make my own little chart of my work. So at the top of it, I put all the different pharmacy to dose medications that I need to follow up on. So the kidney patients that we have on this floor, a lot of them have transplants, so a lot of them are on immunosuppressants, and pharmacy is responsible for monitoring the levels, adjusting the doses, and just staying on top of that part of their care. I have the patients that are on those medications listed at the top of my sticky note, what their most recent level was, how many hours it was from their last dose, their current dose, stuff like that, So I have that at the top because that's usually what comes back later in the day. But then I have my list of patients who are also, on my EHR, just their last name and stuff like that copied over, and then the medical resident that's responsible for them, because sometimes I forget, you have an attending, you have a senior resident, and then you have the other medical residents, at least on my team, that work with those patients, and I sometimes forget who is working with who. So I have to link those up. And then I will put a little X next to a patient when we've seen them, just so I know when we're going through who we've seen and who we haven't. There are other people I've seen who have a paper form that they like to carry around, a printed out list from the EHR of the patients, and then kind of write things on there or tick them off or whatever, which is great. There's nothing wrong with that. I did that when I was a student, but on this team, I don't have like a little cart that I can push around to write things on, and so it's really hard to carry a paper and a pen and my computer at the same time. So I think it's just kind of easier to use it on my sticky note, and then also the next day when I have to print out a new list of patients, I have to then copy information over if I had things from the other day that I want to carry over, and I don't have to do that with my sticky notes. So it seemed really helpful to me. And then as we're going through patients, like I said, I put an X next to the ones that we're done with. If there's things to follow up with over the afternoon, I can also add that to the bottom. So like that's my third part of my sticky note, things to follow up on, which patient and what. And then as I see it come through the queue, I can cross it off and things like that. So it's just been really helpful too, because I can do a lot more on that platform than I can with the EHR that I work with. And I'm pretty sure every computer has it. So I just thought I would talk about it because it took me a little bit to get that workflow down, but it made me more efficient, it made me more accurate, and it, I think, helped the team overall because I was able to respond to questions a little bit quicker. And even on the kidney, rotation that I'm on, I could add little notes like if the patient was on dialysis or not and when they got their last one. And that's just really quick information to be able to give, because a lot of times the team will, again, a lot of patients, a lot of time they'll just like wonder and ask out loud, and I can quickly answer them. So I think it just makes me more of an effective team member. So that's just kind of, what I've done this month on my inpatient rotation to help me, as a generally care focused person, get more efficient and used to acute care life. But there are a lot of different things with being in the acute care setting, and acute care residents probably have a lot better tips as well. But I thought I'd just make a little video about it. So hopefully it was helpful. If you liked it, go ahead and like the video. If you have any comments or questions, put them below. Otherwise, I will see you guys next week.